developing the technology. I can't stress enough how important it is to start early, really trying to understand what is the reimbursement landscape for the technology. So specifically for Exalt Model D, it's used in a procedure called endoscopic retrograde cholangiopancreatography. For purposes of this presentation, we're going to stick with ERCP. So ERCP is a procedure that's been around for many, many years. As Liza mentioned, it's primarily been performed utilizing a reusable duodenoscope. The good news when we did our reimbursement assessment and assessing the landscape for this new technology is that the three key pillars of reimbursement, coding, coverage, and payment, were already established for this procedure. So physicians and hospitals had a unique code to report to the insurance company to let them know that they're doing this procedure. Insurance companies were covering ERCP, both Medicare as well as your commercial payers, and then payment was established and sufficient by the insurance companies. However, we knew that we were bringing to market a single-use technology, and that we needed to make sure that it was financially viable for hospitals to be able to provide this new tool and utilize it so that patients have access. So we started very early on our reimbursement strategy. The other thing I would say is that it's extremely important to think about what markets are you planning on launching this technology. Different regions have different healthcare systems, have different data needs. There's always need for clinical data, economic data. And so starting early, thinking about where you're planning on launching, what type of data is going to be needed should be part of that overall strategy, whether it's including certain sites in your clinical trials. So those are the things that we thought about, but we knew that there was work for us to do. Despite having coding, coverage, and payment, we needed to make sure that it was financially viable for hospitals.